Good morning everyone. Myself Dr. Geetanjli Chawla, Assistant Professor from the Faculty of Physiotherapy, RPIIT Campus, Karnal. Today we are going to learn about the pathophysiology of deep vein thrombosis. So, vessel trauma stimulates the clotting cascade. Then the platelets aggregate at the site, particularly when venous stasis presents, and platelets and fibrin form the initial clot. RBCs are trapped in the fibrin meshwork. Then the thrombus propagates in the direction of the blood flow and inflammation is triggered, causing tenderness, swelling and erythema. Pieces of thrombus may break loose and travel through circulation known as emboli. Fibroblasts eventually invade the thrombus, scarring vein wall and destroying the valves. Patency may be restored. Valve damage is permanent, affecting directional flow. So here you can see the deep vein thrombosis. In first one you can see the normal blood flow. In the second one you can see the deep vein thrombosis formation, and the last one you can see the emboli formation, embolus. So presentation or physical examination, the patient will present with calf pain or tenderness or maybe both, swelling with pitting edema, increased skin temperature and fever, superficial venous dilatation. Cyanosis can occur with severe obstruction. Less frequent manifestations of venous thrombosis will include phlegmasia alba dolens, phlegmasia cerula dolens and venous gangrene. These are the clinical spectrum of the same disorder. Starting with the risk factors like prolonged bed rest, such as during a long hospital stay, or paralysis. When your legs remain still for long periods, your calf muscles do not contract to help blood circulate, which can increase the risk of blood clots, because your calf muscles are known as the peripheral heart of the or the second heart of the human body. Injury or surgery. Injury to your vein or surgery can increase the risk of blood clots. Birth control pills or hormone replacement therapy. Birth control pills like oral contraceptives and hormone replacement therapy both can increase your blood's ability to clot. And being overweight or obese increases the pressure in the veins in your pelvis or legs area. Smoking affects the blood clotting and circulation, which can increase your risk of having DVT. Some forms of cancer increases the amount of substances in your blood that causes your blood to clot, and some forms of cancer treatment also increases the risk of blood clots. And people with heart failure have a greater risk of DVT and pulmonary embolism, because people with heart failure already have limited heart and lung functions, and the symptoms caused by even a small pulmonary embolisms will be more noticeable. Inflammatory bowel diseases such as Crohn's disease or ulcerative colitis increases the risk of DVT. A personal or family history of deep vein thrombosis or pulmonary embolism increases your risk of having DVT or pulmonary embolism, or if having any kind of history of having DVT or pulmonary embolism before, then you are more likely to develop DVT. Being over age of 60 increases your risk of DVT too. It can occur at any age. Sitting for long periods of time, such as when driving or flying, when your legs remain still for many hours, your calf muscles do not contract, which normally helps blood to circulate, and blood clots can form in the calves or of your legs, and if your calf muscles aren't moving for a long time. Complications. Pulmonary embolism. A pulmonary embolism occurs when a blood vessel in your lung becomes blocked by a blood clot or thrombus that travels to your lungs from another part of your body, and usually from your leg. A pulmonary embolism can be fatal, so it's important to be on the lookout for the signs and symptoms of pulmonary embolism and seek medical attention if they occur. Signs and symptoms of a pulmonary embolism will include unexplained sudden onset of shortness of breath, chest pain or discomfort that worsens when you take a deep breath or when you cough, feeling lightheaded or dizziness or fainting, rapid pulse or coughing up of the blood. Post-phlebitic syndrome, a common complication that can occur after deep vein thrombosis, is a condition known as post-phlebitic syndrome, and it is also called as post-thrombotic syndrome. This syndrome is used to describe a collection of signs and symptoms which includes swelling of your legs, which is also known as edema, leg pain, skin discoloration, skin sores, and this syndrome is caused by damage to your veins from the blood clot, and this damage reduces the blood flow in the affected areas. The symptoms of post-phlebitic syndrome may not occur until a few years after the DVT. Tests and diagnosis. A wand-like device, transducer, placed over the part of your body where there is a clot, sends sound waves into the area. As the sound waves travel through your tissue and reflect back, a computer transforms the waves into a moving image on a video screen, and a clot may be visible in the image. And sometimes a series of ultrasounds are done over several days to determine whether a blood clot is growing or to be sure a new one hasn't developed. Blood tests. Almost all people who develop severe deep vein thrombosis have an elevated blood level of a clot dissolving substance called D-dimer. Venography. A dye, a contrast agent, is injected into a large vein in your foot or ankle. An X-ray procedure creates an image of the veins in your legs and feet and to look for clots. However, less invasive methods of diagnosis such as ultrasound can usually confirm the diagnosis. CT or MRI scans. Both computerized tomography, CT scan and MRI can provide visual images of your veins and may show if you have a clot, and sometimes a clot is found when these scans are performed for other reasons also. Thank you.